Difference between ACL repair and ACL reconstruction. Stitching the ends together, that is called repair. Reconstruction means replacing the ACL with the artificial or person's own ligament, which is going to be replaced instead of the actual ACL. So what are the differences and when repair is done and when this reconstruction is done? As you see, this is ACL. If this ACL is torn from one of the ends, this is a femur. If this ACL is torn from this femoral end and the whole of length of ACL is intact, only this is torn from here, we can reattach this to the femoral side. This is called ACL repair. What are the prerequisites for ACL repair? The injury should be very recent. There should not be any stretch or any tear of the ligament itself. There has to be peel off of the ACL from here, and person should be young. These are the prerequisites, 3 prerequisites. And if it is torn from the tibial side, most of the times it is called avulsion injury. Then we do ACL reattachment of the bone to the tibia. This doesn't come in the purview of ACL repair or reconstruction. That is called avulsion fracture. Here ACL repair is a term used to tell if it is torn from the proximal end of the ACL. So let's say what are the advantages and disadvantages of ACL repair. Advantages of ACL repair is that person will have his or her own native ligament. There is no artificial ligament, person's own ligament will be there. Second thing, it is less invasive procedure as we are not going to take any graft from other places. Third thing, recovery might be faster. What are the disadvantages? Most importantly, this specific situation of going to repair the ACL is very rare compared to ACL reconstruction, because this kind of injuries are very rare, which is peeled off and acute, and person should be young. Second disadvantage is that the re-tear rates of ACL repair is higher than ACL reconstruction. The strength of the ACL repair, if there is a gap between the ACL and the repaired part, healing, we are not sure how much strength this ACL which repaired going to be. If this ACL is torn in the middle of the ACL, then this ACL is like a rubber band, it gets retracted. We may not be able to bring this back together and stitch it. Whenever ACL gets torn in the mid substance of the ligament, then most of the times treatment is ACL reconstruction. We all know that ACL is a time tested and proven method. Graft retears are less if it is done properly, and customization of the graft is possible when we are doing reconstruction based on person's background. If a person is of the sports background, competitive or recreational athlete, then we can customize the graft and we can change the graft based on his or her requirement. This customization is not possible with the ACL repair. Disadvantages of ACL reconstruction is that there will be additional incision and additional surgery to harvest the graft, and rehabilitation might be little longer, and person might have little more pain compared to the repair. So in this video we have come to know what is ACL repair, what is ACL reconstruction, for which person ACL repair is indicated, for whom ACL reconstruction is indicated, and what are the pros and cons of both. If you have not subscribed to my channel, please subscribe to my channel to see lot of recent advances in orthopedics, arthroscopy and robotic joint replacement surgeries. Thank you.